Hi, in today's video, we'll explore two important clinical cases, one with a liver mass and elevated tumor markers, and another with a breast lump in a young woman. We'll learn how to identify key features in the investigation results on physical examination in order to choose the correct diagnosis. A 26-year-old woman presents to her primary care clinic with vague upper abdominal discomfort that has persisted for several weeks. She denies fever, weight loss, or gastrointestinal symptoms. Her medical history is unremarkable aside from the use of oral contraceptives and occasional ibuprofen for menstrual-related pain. On physical examination, there is mild tenderness in the right upper quadrant without rebound or guarding. Laboratory studies reveal an ALT level of 75 and an AST level of 64, a carcinoembryonic antigen level of 6.1 nanograms per milliliter, and an alpha fetoprotein level of 850 nanograms per milliliter. She is referred for abdominal imaging and a CT scan is obtained. Based on these findings, what is the most likely diagnosis? A. Benign hepatic adenoma. B. Biliary cyst adenocarcinoma. C. Hepatic hemangioma. D. Hepatocellular carcinoma. E. Metastatic colon carcinoma. The correct option here would be D, and that is because this female patient who is on oral contraceptive and presenting with abdominal pain in the setting of high liver enzymes along with high levels of carcinoembryonic antigen level and alpha fetoprotein level has most likely the diagnosis of hepatocellular carcinoma. And this patient, given the history that she was on oral contraceptives, most likely had an hepatic adenoma which has undergone malignant transformation. Although malignant transformation is rare, hepatic adenomas can undergo malignant transformation to hepatocellular carcinoma, and alpha fetoprotein values above 500 nanogram per milliliter strongly they are associated with hepatocellular carcinoma. Let's have a look at why the other options are incorrect. Hepatic adenomas, they are common in women using birth control pills. However, they are benign tumors and they do not feature elevation of tumor markers such as alpha fetoprotein levels and carcinoembryonic antigen levels. But they can undergo malignant transformation to hepatocellular carcinoma. And option B is incorrect because the lesion seen on the CT scan has an appearance that is more consistent with a hepatic adenoma or hepatocellular carcinoma rather than a cyst adenocarcinoma. Now, cyst adenocarcinoma is a rare tumor which may present with cystic liver lesions and a vague abdominal pain, but it does not typically elevate alpha fetoprotein levels. The carcinoembryonic antigen levels may be elevated, but imaging will often show a cystic rather than a solid mass. And option C is incorrect because hepatic hemangioma is often asymptomatic and discovered incidentally, and alpha fetoprotein levels and carcinoembryonic antigen levels are typically normal, and imaging shows a characteristic hyperechoic appearance on ultrasound or a peripheral nodular enhancement on CT scan. And option E is incorrect because metastatic lesions in the liver are usually multiple and they are well demarcated. A 22-year-old nulliparous woman visits the clinic after noticing a lump in her left breast during a routine shower. She reports that the lump has been present for several weeks without any associated pain, skin changes, or nipple discharge. On physical examination, A well-circumscribed, firm, mobile, and a non-tender 2.5 centimeter mass is palpated in the upper outer quadrant of the left breast. What is the most likely diagnosis? Now, when assessing a breast mass, key factors to consider include the patient's age, duration of the mass, tenderness, mobility, and presence of nipple discharge. These features, they help to differentiate between the benign and potentially concerning causes. The options given here are A. Breast cancer, B. Fibroadenoma, C. Fibrocystic change, D. Galactocele, E. Intraductal papilloma. The correct option here would be B. Fibroadenoma. Now, fibroadenoma is the most common benign breast tumor in women under 30. It typically presents as a painless, firm, rubbery, and a mobile mass, often discovered incidentally during self-exam, and they are not associated with nipple discharge or tenderness. Let's have a look at why the other options are incorrect. Option A is incorrect because while breast cancer should always be considered in the evaluation of a breast mass, it is extremely rare in women in their 20s, especially without a family history or other risk factors. And malignant tumors in young women are typically hard, fixed, irregular, and may be associated with skin or nipple changes, which are not present in the patient in this question. Given this patient's age and the features of the mass of being firm, mobile, and non-tender, malignancy is unlikely to be the correct answer here. Option C is incorrect because fibrocystic changes are benign and common in premenopausal women, often presenting as multiple bilateral tender nodules that fluctuate in size with the menstrual cycle. Unlike fibroadenomas, these changes are typically painful and cyclical. Option D is incorrect because a galactocele is a milk-filled cyst caused by obstruction of a lactiferous duct, usually occurring in women who are pregnant, lactating, or have recently stopped breastfeeding. And option E is incorrect because intraductal papilloma is a tumor which grows within a breast duct and often presents with unilateral bloody or serous nipple discharge without a palpable mass. While occasionally a small mass may be felt near the areola, the hallmark feature is discharge, which is absent in this patient.